there, Mr. Brown. Robert, it's so nice to meet you. I'm very happy to see you today. As you know, we are here today to do an initial exam. I'm just going to take a look at your teeth and your gums. We will do a little bit of minor cleaning, what we call scaling. We're not going to do any deep cleaning today. I see on your chart here that you have an appointment for December 18th to come back for sedation. Okay, that's great. I'm sorry, my name is Dr. Bell. You were referred here by Stephanie Manning. Okay, I know her. We did some work with her. She's a very nice lady. All right. Can you tell me? I've looked over your notes, but I would like for you to tell me yourself how long it's been since you had a cleaning. That's okay. That's certainly fine. That's one of the things we say here is better late than never. We're very glad to have you here, and we do sedation dentistry, as I'm sure you know, and it's nothing to worry about. There are many people in your position who, for whatever reason, may have skipped regular cleanings for a while. We've helped many people get back on track with their dental health. And one thing that I have done here with my office is I try to make it more comfortable, more homey, sort of, not so technical and clinical. I use softer lights. We don't use the harsh lights. I will not be shining a light down in your face for this. This is just, I'm gonna just look around your mouth, and after we're done going over a few things, I'm gonna lay you back in the chair, and I'm gonna just take a look. Okay, nothing's gonna hurt today. We're not, you shouldn't experience any pain. There may be minor discomfort, but nothing to worry about. And when you come back on the 18th, do you have someone who will be with you? Your wife, okay, because you will need someone to drive you home after the appointment. Because of the sedation that we use, you will not be able to drive or operate a vehicle for some time after that. All right, great. So let me make sure I have some things correct here on your chart. And this was given to me by the receptionist. I just want to make sure your insurance is United Healthcare. Great. All right. And we have your number and your policy information and everything. There will be looks like a $20 copay for today's visit, and you can take care of that with the receptionist when we're done. All right. Can you tell me if you've experienced any issues, maybe bleeding, swelling of your gums, any pain in individual teeth or anything like that? Okay. Can you open up for me for a minute? Can I just take a look at that? I'm not going to do anything to it. I just want to take a look at that tooth. Okay, open up. It does look like there's some tenderness and redness around the gums. Okay, I'm going to apply a little pressure with my finger. I'm not going to hurt you. Can you tell me, does that hurt? Okay, I won't do any more. Okay, you can close. All right. How often do you floss? That's fine. That's fine, and we will discuss that also. Just a moment. I'm going to make a note. Okay, great. Oh, I know. I understand. Trust me, you're not alone. You are not alone. A lot of people, as I said, neglect they don't get their cleanings done. It's okay. It's okay, really. We are not here to judge. We just want to help, and it's better late than never, and we're going to help you get back on track with that. Great. All right. I'm going to wash my hands, and then I'm going to put on some gloves, and I'm going to show you some of the instruments that I'll be using today so that you can see exactly what it is that we'll be doing. And after I show you the instruments, I'm going to recline the chair. I'm going to lay you back so you be more horizontal. You won't be sitting upright so much. Okay. Okay. Now, I'm going to stand right here beside you if you don't mind. The first thing I have is a mirror, and it has a long handle right here, and it has a texture to it down near the end of the handle, which allows for a better grip. This is the back side of the mirror and the front, and it is made of metal. And I have two picks. They are made slightly differently. This one has a sharper point. I'm not going to touch it with my fingers. I will put on gloves before we begin. These have been sterilized. And this one has an angled part right here. And it is textured, as you can see, right here and here. And this is more like a hook. It's almost like a Captain Hook kind of thing. It is a bit sharp, but I will not do anything invasive with it. We are going to do the deep cleaning during your sedation appointment, so it's going to be fine. This one, as you may be able to see, has sort of an angled. It slopes down. It gets thinner toward the tip, and we also have sort of a crooked-looking little hook on this side. It is also textured on the ends, right here. All right. And we have this dental tray, which I will place my instruments on as we work throughout the examination today. It's just a metal tray, and it's rectangular, very shiny. This is the tray that holds my implements. And if needed, I imagine it will be, I have this, which is hooked into this machine here beside the chair that you see. And this is suction. This is to remove any saliva or anything else that needs to be removed. We don't use the bowl anymore where you turn over and spit. We don't do that anymore. It's this is a little more hygienic, and we will insert it into your mouth, and it will just suck out all the saliva and everything, so you don't have to swallow that yucky stuff. All right, and it is hooked in, and I have pedals on the floor, which I can press with my foot to operate these whenever I need to. Okay, and then I also have a thing that will blow air. It has a little trigger to it and a red piece that comes out right here. And when I need to blow air, like if I need to dry a section, I can just blow a little bit of air like this. See, you can feel it with your hand. Yeah, it's very gentle. It's not a strong stream of air, and you'll just feel a slight puff of air wherever I blow it in your mouth. Okay. Now, I'm going to go around you like this. I'm going to lay you back now. It's very slowly. I'm going to make sure that you're comfortable. First, I'm going to lower the chair just a bit. Okay, great. Now I'm going to lay the top part back very slowly. Let me come around this way to do that. Okay, so I'm just going to lay you back. So you're going to be facing more upright. Perfect. That's perfect. Okay, are you comfortable? Wonderful. I'm going to put on my gloves and we're going to begin the examination. you doing today? Good, good. Oh, it is a beautiful day. We don't often get weather like this in December. You're right. It's a good time to get out and do things. You know, you don't freeze to death. All right. Now, I'm going to begin. I'm going to stand behind you for just a bit. Okay, I'm going to be right behind you. Now, what I would like you to do, I would like you to open your mouth. Okay, thank you. And now I'm going to feel right under your lower lip. I'm going to apply some pressure right here. And I'm going to put my fingers right under your chin. And I'm just feeling for any abnormalities, anything that may feel that just doesn't feel right now. Okay, you can close. What I'm going to do, can you raise your head up just a little bit? Okay. I'm going to feel under your neck. I'm going to feel your lymph nodes behind, right up in here, and kind of behind your ear. I'm going to apply a little pressure. Just tell me if it hurts when I press here. Does this hurt? Okay, good. Good. All right. Now, I'm going to come around here. I would like you to open for me. Great. And lean your head back just a little. Now, if you would raise your tongue up to the roof of your mouth, I'm just going to feel right underneath your tongue. Yes, I know it's a little uncomfortable. I'm just applying a little bit of pressure. Okay, that feels good. Okay, you can put your tongue down. Now, I'm going to put my fingers back in your mouth, right back behind your back teeth, and I'm going to apply a slight bit of pressure there. I'm going to run my fingers along your gum line. I just want to feel right under there. And the top, if you could just raise up. Okay. Wonderful. Okay. Now, everything feels good. I don't feel any lumps or any abnormalities or anything. This is one way to check for any kind of oral cancer or any kind of growths that are not supposed to be there. Okay, that is good news. Okay, now I'm going to start with this. Now don't be afraid. It's okay. A lot of people do have they get the jitters about going to the dentist. I understand. We have a lot of patients like that, and that is one reason why I offer sedation dentistry, is so that people aren't too afraid to do what they need to do for their health, because your teeth are so important to your health overall. You really need to take care of your teeth. So that's what I'm here to do. Okay, great. Now I'm going to stand right here. Oops. Sorry. I bumped your chart. Okay, great. Now, I'm just scraping just a little bit. I'm running the pick along the sides of your gums. Now just tell me if you experience any pain at all. Anything? No? It may be a little uncomfortable. There is some bleeding. I noticed some bleeding in the gums. That is totally normal. And, yeah. Okay. If you would just turn this to face me a little bit. You do have some swelling in your gums, but honestly, as long as it's been since you had a cleaning, I have to say they really are not that bad. You do have some gingivitis, but it has not progressed to a more serious stage of gum disease, which is wonderful. Okay. All right, let's get some suction. Okay, I'm just going to suction that out. Okay, great. Okay. All right, if you would. All right, I'm going to blow a little bit of air. I'm a little concerned about the tooth that you said was giving you pain. I'm going to take a better look at the back side of that tooth. Okay, so I'm just going to spray a little bit of air on it. Okay. I'm going to look at that one a little more closely. Okay. It looks like we may need to do some work on that one. There is some decay on the underside just below the gum line. Can you, if you could just raise your head up just a little bit. Okay. There is, okay. There is some decay. I'm just gently pressing on your gums. Okay. This is something that we can add to our list of things to take care of when you come back. This is something that I think we might want to address during your next appointment. I don't think we want to put it off too long. I'm going to go ahead and take care of that. Okay. So I'm going to make sure that the hygienist makes a note of that in your chart, in your file. All right. I'm going to lay you back just a little bit more. I know you're almost, feel like you're standing on your head. I know, I'm sorry. All right. What I'm going to do, I'm going to use my mirror to gently pull back the corner of your mouth so that I can see better back into the back of your mouth. Okay, wonderful. So just relax. You just relax your jaw. Okay. No need to be tense. I'm not going to hurt you. If you do experience any pain, you can just tell me or raise your hand, whichever you like. So here goes the mirror. You will feel the pressure on the corner of your mouth. And I'm just doing a little light scraping right there. There is some tartar buildup, but that's to be expected. Okay, all right, I'll stop. I won't do any more right there. I'm going to check the lower, your bottom teeth on the back. So again, I'm going to use my mirror to just sort of pull a little. And this is normal, but there is more tartar back there in the back. But it's not, I've definitely seen worse, so it's okay. All right, I'm going to come around to this side, and I'm just going to, first before I do that, let me look. I'm just going to use my finger to pull your lip up just a little bit, and I'm going to use my mirror to just take a look back there. And see that you've had some fillings. Did you previously see a dentist here in town? Dr. Sterling. Okay. Do you think it would be possible for us to contact their office and perhaps get your records? I know it's been a while since you went there, but any previous information would be useful to find out what type of work you've had done before. Okay, great. I'll contact them and I will see if I can get any records or anything that they might have. Now I'm going to come around to the other side and I'm going to do the same thing that I just did on this side. Okay. You're doing great. And again, I'm going to use the mirror just to pull back gently on your mouth. Okay. I'm just looking around. I'm doing just a slight, very light scraping. I'm just checking it out just to see what kind of tartar we may have or other issues. Have you had any pain in your back teeth? Maybe if you're chewing, or have you experienced any pain in your back teeth? No. Good. It looks like you have had some fillings back here. I see. Yeah, I see 3. All right, you have silver fillings. Do you know how long you've had those? Okay. It does look like it's possible that there's been some deterioration in your fillings, and we may have to go in and replace a few of those. But I won't be able to tell until we do a more thorough exam. Okay. Now, once again, I'm going to use the mirror, and I'm going to use my finger just to pull back a little bit on your lip. I'm just going to take a look at your teeth back there. I can see better with the mirror. Okay. Now, can you bite down for me? Just keep your lips open. Can you just bite down? I want to check your bite. Okay. Just keep them together. Let me look. I'm just going to place my fingers in there, and I'm just checking your alignment, which is really good. Did you have braces? I can tell. The alignment is great. It's really good. Okay, wonderful. Now, right. I would, if you would just open up for me and relax. Don't open up all the way, just open up halfway. I'm going to use this right back here in this section. And I'm going to hold it open. I'll hold your lip up just a little bit. Okay. You doing all right? Okay. I'm going to just do a little bit of removal. There is looks like a excessive tartar. Let's see if I can get that off. Okay. Yeah. Okay. Once again, I'm going to use my suction, and I'm going to go in there because I was able to remove that. So I'll come around here. Okay. And I'm going to put the tube in your mouth, and I'm just going to use the suction for just a moment. Okay. Very good. Wonderful. I'm going to use a little bit of air, so just stay like you are. Just keep your mouth halfway closed for me. Feel that? Just a slight puff of air. Okay, great. Now keep your mouth open. I'm going to take a look and see what we got. Okay. Okay. That's much better. Now, while I'm at it, come down. There was one more I wanted to see. If you would open wide for me, like that. Open nice and big. Okay. and tilt your head down a little, just a little bit. I want to look, again, I want to take a look at that tooth that was bothering you. I'm going to press on your gums again, and the tooth beside it also. Okay. There is some bleeding. I'm going to look, come back here and look at these. I'm going to use my mirror and I'm going to look on the underside of those teeth. Okay. Some suction. Okay. Just a moment. So, I'm going to insert the tube into your mouth. I'm going to suck that right out, alright? That's better. Great. Now, one more thing we're gonna do before we go over a couple things. I want to go in and floss your teeth, and we're going to do it in a way that you may not be used to doing it. Sorry, I didn't mean to bump your leg. A lot of people, when they floss, they don't floss exactly right. I'm going to show you how to do it. All right, let me get some floss. We start here. We have our floss. See? You wrap it around your fingers. Get it nice and tight, like this. Now I'm going to go into your mouth and floss between the teeth, and what you do, you get down between, so you don't just pull it straight down in between the teeth. You want to kind of go down on each tooth, down below the gum line, and kind of go back and forth to get that bacteria out. And it will be uncomfortable the first few times you do it, but after you do it, if you do it every day for 3 or 4 weeks, you will notice a definite difference in the way it feels and in the way your gums look. This will help remove the plaque much better, but you have to go down below the gum line for each tooth. Okay, so if you would open for me, I'm going to get in here. I'm going to get between each tooth. We do have bleeding, and I'll look at that in just a minute. Just bear with me, okay? You're doing great. Just keep your mouth open. Just there you go. And now I understand it's not comfortable. I know. I'm sorry. I want to do the top, and I will certainly give you some suction in just a minute. Open wide, like that. You're doing great. One more. There we go. Now throw this away, and I'll bring you. We're going to get all that junk out of there. And here we go. Just close a little bit. Close for me. Okay. Get all up in the corners. Perfect. All right. I'm going to wipe your mouth just a little bit. I'm going to use your napkin here. Your little bib. Just there you go. Now I'm going to raise you back up a bit. And then I'm going to set you up straight. Well, straighter. There we go. How's that? Is that better? Okay, how you doing? You feeling okay? Wonderful, wonderful. That will be all that I do for your exam today. Now, when you come back for your next appointment, it will be more involved. I just wanted to get a look and see what we're gonna have to do when you come back, to give me a better idea of how to prepare. All right, now you know about your next appointment, so you know when that is. And I have here a little card with your appointment date on it. And I also have a little kit for you with a toothbrush and some toothpaste and some floss and even some coupons in here for some mouthwash and toothpaste, all in a little zippered pouch. And it has a little thing almost like a Ziploc bag and a little handle. You can use this if you travel. You can carry your tooth stuff with you. All right, and I have one more thing for you. This is something that we provide with your initial visit for you to use. And it is a Philips Sonicare toothbrush. See? It comes with a charger right here, and it has a base on it that you just set the toothbrush on it like this, and it will charge. You just plug it up and it charges your toothbrush. And it comes with the all the literature, the warranty, the registration card, and instructions. We will give you one of these when you check out. And they're really great. I think you will enjoy this toothbrush. It takes a little getting used to, but I think after you get used to it, you're going to really love it. It does a great job, not only on cleaning your teeth, but massaging your gums and keeping your gums healthy. Okay, so the receptionist will give you one of these in a box. It will be all boxed up. It won't be loose like this. And you will have that to take with you today. Okay. So I'm going to have the hygienist come in and just go over some checkout papers for you to take up front. And I look forward to seeing you at your next appointment. Thank you. It was very nice to meet you too. Okay, I hope you have a great day.